Good morning, everybody. How's everybody doing today? It's a beautiful day, isn't it? So we'll try and get you out of here so you can enjoy the weather. I'm here again today to talk about Medicare. Uh, you should all know that Medicare is actually national health insurance. It started in 1965. It is not income-based. Medicaid is the program that is income-based. Eligibility, Medicare is for people over the age of 65, those who have been on disability for 24 months, persons with end-stage renal disease or Lou Gehrig's disease, permanent kidney failure, and persons eligible for railroad retirement. Probably most of you are already enrolled in Medicare, but in case you're not, if you enroll 3 months before your 65th birthday, your coverage will start at the beginning of the month you turn 65. If you enroll the month of your 65th birthday, your coverage will start the month after enrollment. If you're already collecting Social Security, government knows that you're turning 65. They keep an eye on all of us, you know. And so they will automatically send you a Medicare card. If you miss the initial enrollment, and I always caution people, do not miss the initial, hi, Lucy, do not miss the initial enrollment. You can always enroll between January 1st and March 31st, and coverage will begin the following month. It used to be you had to wait till July to get coverage if you were late with enrollment, but they changed that, and now it's the month after. There are some special enrollment periods. So if people are impacted by emergency or disaster, like we've had in some of our states recently, if you move or leave a nursing home, you can change your Medicare coverage. If your health plan or employer plan, if you've experienced any loss of coverage, you can enroll. And if you lose Medicaid, if you're on Medicaid and you lose it and you're eligible for Medicare, you can enroll anytime. So we do these seminars at this time of year because it's important that everybody check their Medicare now. So I just read an article that said that 8 out of 10 people signed up for Medicare never bother to check their coverage. So I'm going to talk about checking your coverage and how you should check it today. If you are already in a Medicare Advantage plan, like SumaCare or Anthem or one of those, which we'll talk about later, you should have received what's called an annual notice of change, which told you how the plan you're in now is going to change next year. We're in the period now where you can change your enrollment if you would like, and it started on October 15th. It will end on December 7th. And it includes all Medicare beneficiaries, including people who have both Medicare and Medicaid, because some people actually have both. So people always tell me, I am so confused. I don't understand Medicare. There are only 2 choices for coverage under Medicare. One, you can pick traditional Medicare, and that's when you go to the doctor or the hospital and you use your red, white, and blue card. The second choice is to join a Medicare Advantage plan. And if you join a Medicare Advantage plan, your Medicare card is provided to you by the plan. I want to emphasize one thing about Medicare Advantage plans. People always say when they call me, I'll say, well, what's your coverage? I have a supplemental plan. Well, I know to ask, well, what card do you use? Oh, well, I use my AARP United Healthcare card. You don't have supplemental coverage. You have a Medicare Advantage plan. Supplemental plans are something very different, which I will later discuss. So there are advantages and disadvantages to either choice. The advantages for traditional Medicare is that you can use any provider in the United States that takes Medicare. You don't have to go through hoops like prior authorization. You can add additional coverage to cover your out-of-pocket costs, and that's supplemental insurance. And and as I said, you can go anywhere. There are no geographic restrictions. The disadvantages can be there are no extra benefits, so you don't get a gym membership. There are no out-of-pocket limits, which we'll point out later. You may have to add a separate drug plan if you don't have coverage through the VA or retirement plan. And the supplemental plans can get expensive, and they increase in expense as we age. Medicare Advantage plans have several advantages. They have a lot of extra benefits. They have low monthly premiums, but you still have to have both Parts A and Part B. They also have what we call out-of-pocket limits. So if you have a lot of medical issues and you know your expenses are going to be very high, those out-of-pocket limits can be very important because once you reach that out-of-pocket limit, you no longer have to pay for anything. Also, most of them include drug coverage, so you don't have to pick a separate standalone Part D. All of these plans must cover everything that Medicare covers. So they're not, you still have the same coverage, but there are some disadvantages. There may be some geographic restrictions, although they always have to cover emergency care. Some plans have geographic restrictions, some do not. Prior authorization is a disadvantage. And there have been a lot of studies that have been done recently that found that people were not authorized to have the care they need by Medicare Advantage plans. So now the government's keeping a closer eye on that. There are also provider restrictions. So most of the time, you have to use their doctors, their hospitals, and their other medical providers. And you cannot add any supplemental insurance for your to cover your copays. So I have a joke for you. It's a Medicare joke, if you can believe that. Why is Medicare like a good book? Because it has a lot of parts. Okay. So we're going to cover Medicare Part A. What does Part A cover? Covers blood, covers home health services, covers hospice care, inpatient hospital, and skilled nursing care in a nursing home. For Part A, most of us don't pay a premium because if you or your spouse worked for full-time for 10 years or 40 quarters, that's how the Social Security Administration counts it, we don't have a premium. However, there is a deductible. Unfortunately, the government has not yet released these numbers, these deductibles and copays for Part A yet. Usually they release those numbers the second week in November. You can expect some increase in these numbers. So I'm giving you the numbers from this year. So expect a little bit of an increase. The deductible for a hospital stay this year was $1,632. Again, expect an increase. That covers you for up to 60 days. After day 60, you have coinsurance, which will be about $408. Again, expect some increase there. But how many people are really in the hospital that long? It's very rare. And then if somebody was really ill and was in the hospital for a long time, you have lifetime reserve days. You can only use them once. So after day 90, for days 91 through 150, you would have to pay $816 a day this year for your hospital stay. So you can see co-payments can get quite expensive. Part A coverage of skilled care, and I don't know why it's doing that, but nursing home only covers custodial care. It does not cover, you in the nursing home, if you just need care for bathing or eating or dressing, it only covers skilled care. And let me go back here. Your benefit begins under traditional Medicare. You have to be in the hospital for 3 days, and then it will cover you for up to 100 days. So up to 100 days, most of the time you're not covered for that long. You have to need skilled nursing services or be receiving physical therapy, occupational therapy, or speech therapy to be covered for skilled care in a nursing home. After 60 days of not receiving skilled care in a hospital or a nursing home, you can start a new benefit period, but you have to be not getting skilled care for those 60 days. If you are going to a skilled nursing facility for therapy and your therapy is cut, and we get a lot of calls about this. If your therapy is cut, you do have the right to appeal. You can always appeal any denial of a service or reduction in a service in Medicare. The main question for skilled care is this: can care be given safe and effectively without the involvement of skilled personnel? And what does that mean? That means, can the care be given without having daily skilled nursing, or having that care being done by a skilled physical therapist, occupational therapist, or speech therapist? So you have to prove that. Or are the skilled services that you need, are they necessary to maintain or slow the person's decline? So those are the reasons that you might be able to overturn a reduction in your skilled therapy. I can tell you that under traditional Medicare, Medicare Advantage plans will cut skilled therapy much more quickly than if you're in a traditional Medicare plan. Nursing homes are able to keep you skilled for a longer period of time. Medicare Advantage plans typically will cut around day 20. So you're covered in full for your skilled therapy until through day 20. Then if you're there receiving skilled therapy after day 21, you're going to have a daily coinsurance. And so again, that coinsurance has not been published for next year yet. We'll put that on our website so that you have that information later. So Part A also covers hospice services. Hospice is comfort care, no curative treatment. Services for pain relief are covered. Durable medical equipment, aid and homemaker services can be covered. It includes spiritual and grief counseling. It does not cover room and board in a nursing home if you are receiving hospice care in a nursing facility. You will have to pay the room and board. If a person is receiving hospice at home and the family needs a break, they can send the individual, their family member, to a skilled facility for what we call respite care. And there will be a 5% copay for inpatient respite care. For home health services, Medicare covers intermittent home health. That means it's not going to cover you for a long time. It's just going to cover you. Maybe you go home from the hospital and you need a skilled nurse to come in and visit you. Then Medicare will cover you a little bit. Other than that, it's not going to. You have to be homebound. Now, that doesn't mean that you have to stay at home and you can't leave your house. What it means is, to leave your house, it requires a taxing effort. So maybe you're using a wheelchair. Maybe you're using a walker. You can still be considered homebound. To get skilled services, you have to have a face-to-face visit with your doctor. So it can't be over the phone. Your doctor has to develop a care plan for you. And it can include social services. So that's Part A. Part A is a little bit different. The cost for Part A is a little bit different under Medicare Advantage plans. But again, Medicare Advantage plans have to cover the same things that traditional Medicare covers. Medicare Advantage plans, they don't have that 3-day hospital stay. Usually you can just go from the hospital into a nursing facility. So Part B is the part that covers your doctor office visits. It also covers preventive care. And you have in your folder a list of preventive services that is covered. It covers durable medical equipment like walkers, wheelchairs, oxygen, those types of things. It also covers ambulance services and some administered drugs, usually the ones that have to be administered in a doctor's office. Medicare Part B, we all pay a premium for Medicare Part B. So last year, the premium, or this year, the premium was $174.70. It is projected right now to go up to about $185 a month. Some of you are going to pay a different amount depending on when you entered Medicare and some other circumstances. But new people entering in, they are projecting that amount to go up to $185. This is tied to the cost of living adjustment that's done every year by Social Security. So I can tell everyone who's receiving a Social Security check, tell me if you're receiving a Social Security check. Uh-huh. Okay. Well, you're getting less of an increase this year, but you're getting a 2.5% increase in your Social Security check. And that amounts for the average person. And everybody gets a different amount in Social Security. That amounts to about $50 a month. There is also a yearly deductible in Part B. So every year before you go to the doctor, you've got to meet and Medicare will pay, you've got to meet your yearly deductible. This year was $257, and you can see that was an increase of $17 from the year before. Again, expect an increase in that deductible. Then, once Medicare kicks in to cover your Part B services, you have a 20% copay. So you're going to pay 20% of the Medicare approved amount, not 20% of the total bill, 20% of the Medicare approved amount. So I always give the example, you go to the doctor charges Medicare $120 for your visit. Medicare approves $60. You pay 20% of $60. So you're going to pay $12 for that office visit. The remainder that's left, you are not liable for in the state of Ohio. We have what's called a no balance billing law. I should also note that both Part B and Part D, which I'll be discussing, are income adjusted. So if you are single and your yearly income is this year, this is going to change too. If your yearly income is over $106,000, or if you're married and your yearly income is over $212,000, congratulations, but you're going to pay more for Part B. Some people can delay Part B. So if you or your spouse is currently working and has insurance that's primary to Medicare, and usually if a company has more than 20 employees, their insurance is primary to Medicare. You can, if you want, join Part A, enroll in Part A, but you can delay your Part B because you don't want to have to be paying twice for medical insurance, right? So I have medical insurance through Direction Home. I don't want to have to pay Part B because I'm already paying some of my amount for my medical insurance through Direction Home. So I'm going to delay Part B. If you want to delay Part B, you must inform the Social Security Administration. You can call them, you can go there, you can go online and do it, but you have to let them know. If you lose your, or if you lose your employment, or you decide to retire and still want to keep your primary insurance, and you're covered by COBRA, you have 8 months to enroll in Part B before you're going to pay a penalty. And if you enroll in Part B late, you're going to pay a lifetime penalty of 10% of the premium for each month you were eligible and did not enroll. So you don't want to miss that Part B enrollment. So you saw when I talked about traditional Medicare that there are out-of-pocket expenses, correct? And if you have a lot of medical issues, it can get quite high. And traditional Medicare does not have an out-of-pocket limit. So what happens to cover these out-of-pocket expenses? People purchase what's called Medigap insurance. And in your packet, you will see that you have a chart that shows you all the different types of coverage under Medigap insurance. These are private insurance plans. You have to be 65 in Ohio and enrolled in both Parts A and Part B. The coverage is standardized, meaning that it's the same across the United States. So Plan G in Ohio is the same as Plan G in California. What's different about them is that the premiums can vary by the insurance company that sells them. So it's like car insurance. So if I have car insurance under company X, and let's say I'm paying $600 a year, and I look online and I see that company Y, I can get the same coverage for $450 a year, I'm going to switch, right? So just know that different companies will charge different amounts for the same plan. Plan C and Plan F are only eligible to people who joined Medicare, either it could be just Part A, but who were eligible for Medicare and joined before January 1st, 2020. So you can't get C or F. If you already have F, you can keep it, but you can't get it unless you were enrolled in Medicare before January 1st, 2020. The best time to get these Medigap plans is the first 6 months you have both Part A and Part B. Why is that? Because they can't underwrite you for a pre-existing condition. They can't even ask you if you have a pre-existing condition. So if I'm very, very ill, I'm going to make sure I get my Medigap plan the first 6 months I enroll in Medicare, because they can't underwrite me and they can't ask me about my pre-existing condition. So they can't raise my premiums and they can't deny you. After this time period, if you have a pre-existing condition, they can underwrite you and they can deny coverage for you. These plans are great, but you also need to know that they don't cover prescriptions. You still need a Part D. They don't cover dental, vision, or long-term care. So those are not part of those Medigap plans. You also have in your packet a brochure on Medicare savings plans. And these are programs that can help people with lower incomes and assets pay for their Medicare. So if they qualify as a qualified Medicare beneficiary, they can get both their Part A and Part B premiums paid if they have a premium for Part A, and some people do. It will pay all their copays and all their deductibles. Specified low income beneficiary, QI and QDWI, you can get your Part B premium paid for. So those income and asset limits should be in the brochure that you have in your packet. How do you apply for these benefits? You can go to Job and Family Services in your county, or you can call DHAD at 1-800-421-7277 and someone will help you. So now we're going to talk about prescription drug insurance. Part D is included, as I mentioned, with most Medicare Advantage plans. If you're not in a Medicare Advantage plan and you don't have other coverage, you need to select a standalone Part D plan. And in your packet, you also have a chart that shows you what those plans are. And it looks like this. It's got this green band at the top. These are standalone Part D plans. What does standalone mean? Means they only cover drugs. You don't need a standalone plan if you have coverage through the VA. That counts as creditable coverage. You may still want one if one or more of your prescriptions is not covered by the VA, but typically you don't need it. If you have creditable coverage under an employer or retirement plan, you don't need a standalone Part D. So you need to check on creditable coverage, especially for next year, because Part D has changed, and I'm going to get to those changes, and there's a limit to your out-of-pocket costs now on Part D, which is good news. Again, you need to make sure you get a Part D plan when you're eligible, or again, you'll pay a lifetime penalty, which is 1% of the national base premium for each month you were not enrolled and were eligible. The national Part B premium, the average premium is $36.78 in 2025. You cannot enroll in Part D mid-year. So even if you don't take any prescriptions, if you get sick in the middle of the year, you can't get a Part D plan unless you go on Medicaid, and then they'll let you get one. So you want to make sure that you enroll in at least one plan. So if I'm not taking any prescriptions, I'm going to look at this chart and I'm going to find the cheapest plan and enroll in that. These are changes. Now, these are real numbers for 2025. The government has released these numbers. So you can have an initial deductible. All the standalone plans, I think, do. Let's see. You got one or two that don't. But it can be as high as $590 for the year. That's pretty high. And you'll see a lot of them have that $590 or close to it for next year. The initial coverage limit, this is the amount you had to pay out of pocket before you fell into that donut hole. Last year, it was $5,030. That is now gone. It is eliminated. There is no the maximum out of pocket now is $2,000. That is good news. So once you so you're going to pay a co-payment of about 25% of the drug costs, might be less with the plan you choose. If you have high costs and they add up to $2,000, you're done paying. So that's gone, and catastrophic coverage kicks in and you have no more out-of-pocket costs. So that is part of the Affordable Care Act. Medicare prescription payment plan. You can also choose, if you have high medication costs, you can choose to have them spread out over the course of the year now. You're going to have to tell your plan and they will set up monthly payment costs. And you can either pay that directly or it'll come out of your Social Security check. So you can spread those costs out, and that's good news for seniors too. Standalone plans. That's these in green that y'all went, ugh, when you saw them. They could have increased their premiums more, but because of the Inflation Reduction Act, they were asked to not increase their premiums more than $35 a year. It was called the Premium Stabilization Program. So they kind of, twisted their arms on that one. You can see that many have the highest possible deductibles. We also see a reduction in the number of standalone plans for 2025, and very few of those plans actually qualify for a zero premium for people who get the low income subsidy, or what we call extra help. Part D considerations. Prescription costs vary significantly for both Medicare Advantage plans and the standalone Part D plans. So I put my 2 prescriptions in, and there was a big difference from plan to plan and what I would pay. So you want to look at the cost. That's why you have to have an analysis done. You also want to make sure the prescriptions that you take are covered. I have coverage through Direction Home, and I just received notice that they're not covering my Synthroid next year. So I'm not going through the mail order anymore because I'm not changing the type of Synthroid that I take. I'm just going to go to the drugstore. I'll pay more, but that's what I'm going to do. The other thing you want to look for when you do an analysis is if there are prior authorizations that are required for your medications. And you want to make sure that you get that prior authorization before the new year begins. Plans can also say that put limits on quantity. That's usually more for narcotics, but they can do that. Also, pharmacy network. There are what's called in-network pharmacies and out-of-network pharmacies. If you are going to an out-of-network pharmacy, you are paying more for your medications than if you are going to an in-network pharmacy. So don't go to the drugstore and say to the pharmacist, do you take this plan? Because they're going to take all the plans. What you want to ask is, are you an in-network pharmacy for me? And then they have to tell you the truth. The other thing you want to look at are the star ratings. And when I looked at these star ratings on these standalone plans, I don't know that I would choose a plan that had a 2.5 star rating. I typically tell people, don't go below 3 stars. Because there's reasons why they got a 2.5. It could be, and if you're doing an analysis, you can actually go into the Medicare website and you'll see where they were rated low. It could be customer service. It could be ease of getting your prescriptions. It could be denials. So they look at a number of things for those star ratings. Here they are: member complaints, the number of people who leave the plan, the plan provision of accurate pricing. That's a big one. Ease of filling prescriptions, and changes to the plan, because these plans can change what they cover and their costs mid-year. I mentioned the low-income subsidy. People who qualify for this, and you have a brochure on this in your packet too. People that qualify it's been expanded to cover more people next year. They pay zero for premiums, and they don't pay any deductibles in plans with premiums in Ohio that are below $39.30. They will also have reduced copays for generic and brand name drugs. You can call Direction Home, or you can go to the Social Security Administration website and apply to see if you qualify for the low-income subsidy. You can also call the Ohio Senior Health Insurance Information Program, OSHIP, and they have qualified Medicare counselors. They're actually a government, they're paid by the government to help people on Medicare select plans, and they're very good at what they do. You can visit the Medicare website, and I, I find if you use a computer, it's really not that hard to use. If you don't use a computer, have your kids or your grandkids do it for you. So now we go to the last part, Medicare Part C. These are Medicare Advantage plans. You have to have both Part A and B to join a Medicare Advantage plan. Most include drug coverage. If they don't include drug coverage, you have to select a standalone Part D. So that's this chart. You people like these charts. So it takes me a long time to do these charts. So next time you can bring me candy. These plans at the end, the ones on the last page. Did I drop something? Oh, I'll be careful, thank you. I don't want to fall. On the last page, those are the ones that don't have drug coverage. That's why they're in red. But most of them have drug coverage. You'll see that these plans have what are called out-of-pocket maximums. So once you reach that out-of-pocket maximum, and it does not include prescription costs, you're done for the year. Some have zero premiums. As I mentioned, most of them don't require a 3-day hospital stay to get skilled therapy in a skilled nursing facility. But there are often provider limitations. So if you have provider limitations, you want to make sure you're in network. And that's why I put doctor choice, yes, no. HMO, POS, POS stands for point of service. That means that your doctor can send you out of network, but you might pay a little more. If it's just an HMO, you can't go out of network. Anything that has POS, you can. PPO is preferred provider organization. And there again, they may have some preferred providers where you're going to pay less, but you can go out of network. So you want to make sure you know what type of plan you're getting into. These plans contract with the federal government to provide Medicare. That's why I said there's only 2 kinds of coverage you can get, right? You can get traditional Medicare, you can get a Medicare Advantage plans. They are not supplemental plans, but they do offer supplemental benefits. If you were on Medicare Advantage and you had a supplemental plan with it and you wanted to switch to a Medicare Advantage plan, drop the supplement. Your insurance agent's supposed to tell you you can't have both. If you join a Medicare Advantage plan and you decide you don't like it, you can switch to traditional Medicare or switch to another Medicare Advantage plan between January and March of each year. So what are some of the extra benefits that we still see? Everybody likes this one, right? Silver sneakers, fitness benefit. Telehealth. I don't know if that's really I don't know how I feel about telehealth. I'll let that one go. Cash cards. Yeah. Yeah. Where you get these cards and you can go to the drugstore or buy food. Most of the plans do offer something like that next year. They all offer dental, hearing, and vision benefits. Some offer transportation benefits, but I didn't see a whole lot of that. But some do offer a transportation benefit to medical appointments. When you're looking at these plans, you want to, of course, look at the cost, and you want to look at the cost for services that you use a lot. So if I'm getting a knee replacement, what am I going to look at? I'm going to look at how much am I going to pay when I go to the hospital while I'm there? How much am I going to pay in a skilled nursing facility when I'm getting rehab? Or How much am I going to pay as an outpatient getting rehab? I'm going to look at those three things. So you want to look at what you use most. If I don't go to my primary care physician very often, but I go to a lot of specialists, I want to know how much I'm going to pay for a specialist visit in these plans. What I saw, it can range. I think there was one plan that had $25 payment to see a specialist. Most of them were $35 to $45 to see a specialist. You want to look at their formulary. Do they cover the prescription that you take? And what are you going to pay for those prescriptions? What pharmacy should you go to? So you want to look at all those things. You want to look at if there's a lot of different plans, like if you notice on this chart, there are a zillion plans that Humana has. I hate looking at their plans because they don't even name them different things. So my eyes just go blurry when I'm trying to look at this stuff. So sometimes there's just very subtle differences in these plans. You want to look at the star ratings again, and 5 stars is the highest. We don't have any 5-star plans this year. We do have some 4.5-star plans, and a lot of our local plans were actually rated very, very high. Again, I'm going to say don't go with a plan that's lower than a 3.0. So make sure you look at that. And you want to find out about the plan reputation. And I'm not just talking about your neighbor saying, oh, I got this plan. You need to get that plan. No, you got to look at all these other things. And what you want to do is call your doctor's office and make sure they take the plan, because what they tell you online about the provider network may not be correct, because it can change like that. A doctor's office can decide, I'm not taking that plan next year. So call your providers, make sure they take your plan, and then ask them, how easy is it for for me to get coverage for the services you prescribe for me? They'll tell you. They'll tell you which plans put them through the ringer with prior authorizations and which plans deny the most. Medicare Advantage star ratings. This is some of the things they looked at. Preventive measures. So, did people get their shots? Did they go for mammograms? Member complaints. That's a biggie. Appeals. How often did people appeal? Members who chose to leave the plan. And did they provide their members with important information? Because some plans might offer those cash cards, but they don't really, you don't read the fine print, so you don't even know you're supposed to get a cash card. So you want to look at that. But I will say this, those cash cards are great, but insurance works on what's called actuarial information. You know what that means? If they're giving you something, they're taking away something else. When I looked at the local changes to Medicare Advantage plans, our premiums remained relatively stable. We have a lot of choices in all our counties. I didn't really see anybody really big plan pulling out, but there were increases in those out-of-pocket maximums. And I saw some pretty huge increases in those with some of those plans. And again, that's something you want to look at if you have high medical costs. Do you want to pick a plan that has a $6,000 out-of-pocket maximum, or would you rather pick one that has $3,500 or $4,900 out-of-pocket maximum? There were also increases in those drug coverage, those deductibles. A lot of the plans added deductibles that didn't have them, and some plans increased the deductibles. So some extra benefits may be reduced. If you're getting it, as I said, if you're getting something over here, they're taking away something over there. I can say that because I'm not a government employee. As you heard, we're a private nonprofit plan. And I'm an ombudsman, so I always tell the truth. There are also what we call special needs plans. And these are plans that cover people with chronic conditions or people in nursing homes or people that have both Medicare and Medicaid. We call those people duals because they have a dual benefit. They have both Medicare and Medicaid. We don't have a chart on these. If anybody wanted information, I can get it for you. They are zero premium plans. Again, their benefits vary and should be compared. They do include fitness benefits, which I was surprised to see, but they do. And a lot of them have a transportation benefit. And if anybody is in the audience who is currently a dual, that means you're on MyCare Ohio. You will be forced next year by Ohio to choose a DSNP. So that's a dual eligible special needs plan. We don't have any information about those plans, so I can't speak about them yet. But I just wanted to throw that in so that you are aware of that. MyCare Ohio plans currently, as I said, are for people that have both Medicare and Medicaid. Those people have to choose either CareSource or United for their Medicaid. They can choose the same plan for their Medicare too. So they can have CareSource or United for both Medicare and Medicaid. Or they can have just the plans for Medicaid and choose whatever they want for their Medicare. That gets a little complicated, but they can do that. If they opt in, and that means they chose the same plan for both Medicare and Medicaid, they have extra benefits that they would not have had they what we call opted out or chosen another Medicare plan. But this year, if they choose a DSNP, so United has DSNPs, CareSource has a DSNP. If they choose one of those, they get even more benefits. So it gets very complicated for these people. And guess who gets to deal with all the complaints in MyCare Ohio? I do. I love fighting insurance companies. So again, you need to analyze these things. If you can't do it, have somebody do it for you. Call Medicare or call OSHIP. And they have counselors that will assist you. Choose wisely. Now it's open enrollment. Again, if you choose a Medicare Advantage plan, you don't like it, you can switch to another one or switch to traditional Medicare from January to March. People who have both Medicare and Medicaid can change plans monthly. I don't recommend that because there's some catch-up time that happens and coverage can get messed up, and yours truly has to help fix it. So don't do it. There are some marketing guidelines I want y'all to be aware of because we know our mailboxes are full, right? Full of stuff. If you're in a Medicare Advantage plan now, they can call you. So you're going to get phone calls. They're not allowed to, it prohibits ads that do not mention a specific plan. So you know those commercials on TV? Call us and we'll help you pick your plan, blah, 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 blah. What they don't tell you is most of the time they're brokers and they only work for specific plans. So they're supposed to tell you which plans they are representing, okay? So they don't always represent all the plans. In their ads, they're not supposed to mention the words best or most. They're not allowed to do cold calls at home, and that includes nursing facilities, apartment buildings, no cold calls. And once you choose a plan, they're supposed to tell you how that will affect your current coverage. What about your doctors? Will they be covered? What about your pharmacies, your medications? What about the cost differences? They're supposed to review all of that with you. And I don't tell people never to go to brokers because there are some brokers that are very good. What I do tell people is do an analysis yourself. so you know what the broker is talking about. And you know what might be best for you, and then you know what questions to ask. I want to just mention appeal rights in Medicare again. As an ombudsman, you have the right to appeal your coverage and payment denials for covered services. Most people don't appeal, but you know what? A lot of people who do appeal get those coverage decisions overturned. Appeal rights are slightly different for Medicare Advantage and traditional Medicare, but just slightly. Prescription appeals should go through your doctor. So that goes through your doctor's office. I mentioned in Medicare Advantage, prior authorizations are now being monitored by the government because they found when they did studies that there were services that were not authorized that should have been authorized. And this is new. Appeal steps for observation status have now been released. It's hot off the presses. So if you're in the hospital and you're told you're an inpatient, and then they change your status to outpatient, you have the right to appeal. And that appeal, you can ask for an expedited appeal, and they'll give you a decision within 24 hours. This new rule also goes back to 2009. For people who were told they were inpatients and then they changed their status to observation status, they become part of a class action lawsuit and they can appeal. In other news, Medicare trustees report, I look at that every year. So this year, they have said that Part A is funded and solvent through 2036 if all things remain stable. Part D and Part B are different because we pay premiums for those. So we don't have to worry about that. Expenditures for 2023, they always go back like 2 years. So for 2023, look at that, $848 billion expended. That accounts for 3.6% of our gross national product, 13.7% of our federal budget in 2023. So Medicare can get expensive, but we all have to keep an eye on what's happening in our government. If you want to keep your Medicare, keep an eye. The Inflation Reduction Act said that all recommended vaccines had to be covered by Medicare now at the pharmacy. So you don't have any outpatient costs for that. $35 copays for insulin. That's the highest amount a plan can charge for insulin. And it might even be less in 2026 because some plans are actually charging less than $35. Again, if you're taking insulin, you'd want to do a cost analysis using the Medicare website because there could be a plan that's charging less than $35. As I mentioned, next year, your out-of-pocket limit for prescriptions will only be $2,000 per year. And Medicare is now negotiating prices for drugs. So have my list here. So for 2025, the following drugs were negotiated prices, although I have to tell you, pharma is taking government to court. Eliquis and Xarelto, blood thinners, diabetes drugs, Januva and Jardiance, rheumatoid arthritis drug, Enbrel, blood cancer drug, Imbruvia, Farxiga for diabetes, heart failure, and chronic kidney disease, and Entresto for heart failure, Stelara for psoriasis and Crohn's disease, Fiasp and Novolog for diabetes. So those were the 10 drugs that were price negotiated for 2025. In 2026, they're going to add another 15 drugs. And what they do is they look at how many people take the drugs and what are the highest cost drugs. And that's what they're trying to get pharma to negotiate. Yeah. There are some legal battles and other advocacy efforts going on. The Center for Medicare Advocacy is suing Medicare for violations of federal law protecting people to their rights to home health care. So if you go to their website, it gives you some pretty good information. They feel that some home health agencies have denied people inappropriately for home health care. I mentioned pharma suing the government over the price negotiations. I talked about, when I made this slide, they hadn't announced yet that there's an appeals process that is now in place for observation status. And those of you who are members of a Medicare Advantage plan will receive a letter from your Medicare Advantage plan around mid-year next year telling you what benefits you have not used. Because what they found was, like with those cash cards, some people didn't even know they had them. So now they have to tell you, oh, you have this unused benefit. So that's all a good thing. And then now I'm ready to take any questions you might have.
Around, and I know many of us have loud voices, but please let us bring the mics to you, and that just allows our Zoom participants to hear us as well. So go ahead and raise those hands high, and we will bring the mics around.
No political questions.
I do not see a Medigap plan form in my packet. I believe you mentioned they were available in addition to the Medicare Advantage plans.
Yes, we don't have a form because there's a whole slew of companies that sell them. If you call OSHIP, they can tell you there's probably, I don't know, 35 companies that sell Medigap plans. AARP sells them, Humana sells them. Most of the big companies sell them. So you can get phone numbers, and I would check at least 3 companies to compare prices for Medigap.
You mentioned Eliquis, and I think they negotiated that in for 25, but it doesn't come into effect till 26, correct? The
I
price
think you
doesn't
are.
drop.
I think you are correct with that. Yes,
Okay.
because I had a lady call me about Eliquis because it's so expensive.
And then back there with Tiffany.
You mentioned about the checking the star ratings. Last week I did meet with a broker after I had done my Medicare.gov search. And the broker told me that 2024 star ratings would not be available until January 5th. So I asked him, I said, so how am I supposed to know star ratings for this year to make my decision? What
They're
company-
out. I have them on there on your
Okay,
chart.
Good. Second question is, I am switching. I am dual advantage. I have extra help. I'm stage 4 cancer survivor, 2 years.
Good.
So I am
Congratulations.
switching. But I am switching from my current plan back to my old plan because 3 of my cancer drugs that I was on this past year have a dramatic cost increase. And going back to the old company, they're staying at the same price. So you really have to do you just really have to check and check and check. And as you said, things can change monthly. When you get that cancer diagnosis, your whole world changes, and then you're left to figure out what's going to be the best coverage for you. And so I applaud you for making sure you press that issue, constantly check, check, check.
I try every year as they check. I'll take this gentleman up here.
The appeals process, who do you contact for those OSHA?
He's asking about the appeals process. Who do you contact for that? For the appeals process, if you, are you talking about way back when, 2009? If it's in the past, I would contact OSHIP and they'll direct you probably to medicareadvocacy.gov. If it's current, so you're going to receive a notice that there was a change in your status. So then you appeal.
And we've got,
It'll be in the notice. You'll appeal to Medicare itself. Yeah, you'll go through the appeals process.
and we've got a question in the back of the room, but as I'm seeing Zoom questions come in, I want to let those folks know we will get to your questions. We're going to take care of some in the room. And then we have somebody with us who can read your questions to Francine and get those answered for you as well. But hang tight with us. And this question here.
Okay. I take care of my nephew who is on Medicare, Medicaid,
Yes.
and I'm taking him this week to get cataract surgery. They had charged him $150 for medication for his eyes, and I had to pay because he has no savings, no nothing. Can they do that?
Yeah, I'm going to have you call me. I'll have to look up the medication. If it's covered, they shouldn't. If he's on Medicaid, then Medicaid should cover it. What plan is he in?
My
Care Source or United?
care source.
Give me a call. Just call the agency, ask for Francine, and I'll find out if it should have been covered.
Okay, let's go with Tiffany and then we'll come back to you.
You referenced the Affordable Care Act during your presentation.
Yes.
I just want to clarify that everything that we've heard today is contingent upon the Affordable Care Act continuing. Is that true?
I said no political questions.
I had to do it. Thank you.
Do we want to answer? Let's get this one back here. I'll bring a mic up to you in a moment, sir.
With the drug plans, including the drug deductible, is that deductible going to be what we pay or the cost of the drug?
That's
Yeah.
what, so if you have a deductible, let's say it's it's $350. You're going to pay the first $350 when you go to the drugstore before your plan kicks in.
So is that going to be the total, like I take a medication that's $800 a month. So
So
I'm
you'll
going to
be
have to pay the total cost of that $800?
No,
or
you're going to just pay the $350.
the one-time thing and then the deductible's covered.
Right.
And so then the $2,000 a year, again, is that
Yep.
is that going to be what I pay or
That's going to be,
the cost of the medicine?
that's going to be what you pay. So if you're paying $800 a month, they're going to conclude that $350 too. So you're going to hit that in 3 months. And then you won't have any more copays.
Okay. Thanks.
No, okay, thank you,
I
Francine.
have a secondary insurance to Medicare, not a primary. If I should drop it and want to go to a Medigap policy or something, am I going to have any problems? Am I going to have to pay extras?
Okay, you say you have a secondary insurance. Is it a retirement plan? Okay. If you have a retirement plan and you drop it, just know that most of the time you cannot go back to it. If you wanted to drop it to go to a Medigap plan, you will have problems getting it if you have any pre-existing conditions. And that includes even high blood pressure. I mean, any pre-existing conditions. They can deny you coverage and they can underwrite the premium.
Okay, we'll take, if it's okay with you, we'll do a couple from online and then come back to the room.
Okay. I'm easy. Not
All
that
right,
kind of
we just
easy.
got a few questions coming in from online. Sorry, I was hearing double when I had my headset on. First question, where can I buy the fundraiser tickets and what is the address of the new location for Tai Chi classes? Lori, if you want to take that away.
Heck yeah, I do. Okay,
That's
so.
a plant.
Yeah. We paid our staff to do that. Yeah, so you can go to our website, which is www.d as in David, HAD as in David.org. That's our website to purchase raffle tickets. I believe, is it on our homepage? I believe it's right there on our homepage. So as soon as you land there, you should see something about our raffle tickets. For the in-person peeps, we do have some out at the check-in table. So if you would like to purchase one here today, one or more, here today, we can do that for you. Address for Tai Chi, our new lovely office. Do y'all like this office in person? Yay.
It's like coming to work in a fancy hotel.
It is. I mean, Pinky's out. But the physical address is 1949 Town Park Boulevard, and that is in Uniontown. I have that class set to start in January. And again, that information is also on our website. So if you go to that dhad.org, and you'll see 4 tiles across the top left. There's one that says something about education. Hover your cursor over that, and when that drop-down menu pops up, you'll see something about our wellness classes. So that's where you'll find information about Tai Chi, and Tai Chi is super fun. There's only 20 spots open, so if anybody wants to register, do it soon. So we'll take another question from online and then get back to the in-persons.
Promise the rest of these are actually about Medicaid. We just wanted to plug that real quick. So the slide said 65 and over automatically qualify for Medicare, but if they did not work enough credit hours, they don't, right?
They do, but they'll have a premium for Part A.
Any questions over there? Any questions at all? Holy smokes, you're good. Oh, there's one.
With Summa being sold, is there any chance that they'd end up changing their Summa Care, like in the middle of the year or something? Summa Care have anything to do with the selling of Summa?
He's asking about Summa Care changing its coverage in the middle of the year. I doubt that, but I really don't know for sure. Yeah, I don't know. I would ask somebody, well, I was going to say ask somebody from Summa, but we know how that goes. Yeah, I don't know. I don't know how that would affect it. I mean, usually the plans are set and the contracts are made with the government ahead of time, but I don't know if that allows a new owner to change it. Good question, though.
Really
I'm
good
going to look
question.
that one up.
Any other questions? Oh, here we go.
Do you have a list of brokers that represent a lot of the Advantage plans?
I do not.
Mm.
What I would do, we gave you the phone number to the Advantage plan. Call the Advantage plan and they'll connect you with a broker.
Any other questions? Hey, Tiffany's coming up behind you here.
Okay.
I have a retiree plan with Summa,
Mhm.
and they tell me every year that they are not required to notify us of changes until right before the deadline to switch.
The retirement plans are different than these plans. So she said she has a retirement plan with Summa, and a lot of people have Medicare Advantage plans like STRS has plans. Yours is with Summa. Those plans are different than these plans. Those are negotiated separately with your employer.
So they don't have to provide that information.
No, they don't. Just like I don't know what my insurance is going to be yet. They haven't, they talked about it, but I haven't seen an enrollment form yet. So
Generally, my plan is like one of their plans. I don't know whether I don't remember which one it is, but I could drop my employee plan and switch to that other plan.
you can drop your employee plan and switch to another plan, but know that you can't go back to your employer plan, usually.
Okay, thank you.
We'll take another couple from online and then come to you.
All right, a couple more from the online chat. Why do some Medicare Advantage plans have 2 amounts, in-network and out-of-network?
Because they want you to use their in-network providers, so they have negotiated prices with those people. But if they allow you to go out of network, you typically will pay more. So that's why that is.
Question about Humana. Is Humana eliminating the cash card?
From what I've seen, when I looked up those extra benefits, there were some plans that had a cash card with Humana and some didn't. But I don't include that information because I don't want people picking plans based on that. I want you to look at the other stuff first, and then you can look at the cash cards.
And then one more question for online at the moment, and then we'll get back to in person. What can you do when the plan updates in July for the plan?
If they, you mean, well, the question's probably saying if like their prescription benefits change in the middle of the year, you really can't, you can't do anything. You're stuck unless you're a dual and then you can change plans. Or if you're coming out of a nursing home, you can change plans.
We'll go to that end of the room.
I just want to say, do not be afraid of the Medicare appeal process. I just successfully appealed
Yay!
the cost of a port that Medicare had denied, and I think it was coded wrong. But it was a very simple process to
Yeah.
take that form, and they approved it, and the bill all of a sudden dropped like
That's really-
$4,000.
I'm glad you mentioned that because it can be coding errors with some of this stuff. I mean, that happened to me with my doctor and I was like, what did you guys do? And it was a coding error.
Any other questions from the room? All right, back to online.
We can wrap up some of the online ones then, yes. Medicaid only members with no Medicare, will they be offered OTC benefits?
Usually the OTC benefits come with, say that again. Give me that question again.
Give me just 1 second. Let me scroll back up to it. Medicaid only members with
Okay.
no Medicare, will they be offered OTC benefits?
I don't think traditional Medicaid fee-for-service offers any over-the-counter benefits, but ask your plan.
This individual, their family member is no longer receiving home health services. The agency has been coming and informed us since July 31st, 2024, Medicaid stopped paying. What are the steps to get Medicare if you have lost those previous plans?
So I don't know if the person's still on Medicaid. If they're on Medicaid, an appeal can be done through the Medicaid plan. If they were on Medicare also, Medicare would have covered that first. So you have to meet all the eligibility requirements to join Medicare.
And then last question for online. If someone is eligible for Part A and B and chooses to stay on a working spouse insurance plan when they turn 65, do they have the ability to then choose traditional Medicare at a later time?
Yes, if you have a spouse who's currently working and you want to go on their plan and you already chose Part B, all you have to do is call the Social Security Administration and tell them you don't want to pay for your Part B any longer, and just you can pick it back up later. You have a radio voice.
They always said I had not only the voice, but also the face for radio. If you know, you know.
Any other questions? Okay, well, thank you all for coming and indulging us and getting our commercials for our raffle and agency and all that. And we sincerely appreciate you coming and take care.
Yeah, this was recorded. This was recorded, so if you want to review anything that Francine shared today, it again is on our website, dhad.org. And then go to that education tab. You'll see under that pop-up where it says Medicare Education, and the recording will be up there. Give me till tomorrow to slice and dice and post it, but it will be there for review. And one more question?
Not only was this informative,
No, it's on just for this.
not only was this informative as it is every year, the part about the spams and all that was very informative. this
Great,
year.
great.
Thank you very much.
Yeah.
Yeah, we'll email those things out. Perfect. Thank you. Have a great day. Enjoy the sunshine. We got it.